Hi, welcome to this webinar on the Wisconsin Tobacco Quit Line. My name is Kate Kobinski and I work at the University of Wisconsin Center for Tobacco Research and Intervention, and I manage the Wisconsin Tobacco Quit Line contract for the state of Wisconsin. So my goal for this presentation is to provide a primer on the Wisconsin Tobacco Quit Line for staff who are not very familiar with it, and also to hopefully provide some more detail for veteran staff in the tobacco program. So let's start with an overview of the Quit Line. The Quit Line has been operational for over 16 years, launching in May of 2001, and has always provided free, confidential, individually tailored smoking cessation services over the phone. There are a couple ways to access the Quit Line, and not surprisingly, the method used the most is an inbound call by using the national Quit Line number, 1-800-QUIT-NOW. Data from all of 2016 shows that 85% of people access the Quit Line that way. We also do have a second means of accessing the Quit Line through a physician referral, either through a hard copy fax referral or an electronic referral from an electronic health record. And in 2016, that accounted for about 14% of referrals. And I'll talk a little more about that method later in the presentation. Now I want to take just a minute to establish the evidence base of Quit Lines. According to the 2008 Clinical Practice Guideline for Treating Tobacco Dependence, Quit Lines are recognized as being a highly effective means for helping tobacco users quit. Again, in 2008, the Clinical Practice Guideline rated the strength of evidence of Quit Lines as an A. Specifically, a review of the research showed that phone counseling increased quit rates 60% compared with no counseling, minimal counseling, or just self-help materials. And additionally, when phone counseling is combined with medications, it increased quit rates by 30% compared to just using medications alone. Here in Wisconsin, back in 2010, we did an NCI-funded study, again, specific to the Wisconsin Tobacco Quit Line. And in this study, we showed there was a 6-month quit rate of 38%. And this was a 7-day intent to treat quit rate with a multi-call program and 2 weeks of the patch. The Quit Line is pretty widely accessible, available 24 hours, 7 days a week, except for 3 holidays. I believe it's Christmas, New Year's Day, and the 4th of July. There's a TTY line for people with hearing and speech difficulties, a dedicated phone line for Spanish-speaking callers, and translators available in almost any language through an AT&T translation service. As I mentioned at the start, the Quit Line services are managed by the UW Center for Tobacco Research and Intervention, funded by the Wisconsin Department of Health Services through the Tobacco Prevention and Control Program, and also supplemented by CDC Quit Line funding, and also through our center periodic federal research grants that we run on the Quit Line. The services themselves are provided by a company called Optum, and they are in Seattle, Washington. The majority of people who use the Quit Line are tobacco users, as you can see here, 96%. But I show this slide just to illustrate that the Quit Line also provides information and support to other people, like healthcare providers who might be looking for information about medication, combining medications, dosing information, maybe some techniques to use with their in treatment plans. The Quit Line also provides support to friends and family members. We call those proxy callers who want to help someone quit tobacco, as well as just inquiries about the Quit Line from the general public. Next, I'll show you a snapshot of quitline utilization since 2001. And in total, over the last 15 years, there have been over 280,000 total hits to the quitline call line. 186,000 callers registering for some service, and 170,000 of those are tobacco users receiving services. Generally, the quitline registers about 9,000 tobacco users a year, and of course that does fluctuate a bit here and there, which accounts for about 1% of Wisconsin tobacco users. And this is typical, I think, of most state quitlines. The amount of reach of a state's tobacco using population is largely dependent upon funding, having both the dollars to advertise to increase demand for the quitline and then actually having those dollars to support that increase in demand. There are some states that still are using their tobacco settlement dollars and are able to serve 5% or more of their tobacco users, but that's, I think the norm is probably around 1% for most states. And just as a reminder, the current adult smoking prevalence is 17%. And this graph illustrates the total quitline call volume year to year. You can see it fluctuate over time, though I think in recent years the call volume has settled around 15 to 20,000. In 2008, with over 40,000 calls that year, that really was kind of an outlier year, and it was when the quitline experienced 20,000 calls in January and February alone because of the increase in the cigarette excise tax here in Wisconsin at the same time that the state began providing funding to supply the nicotine replacement therapy through the quitline. And of course it all happened on January 1st at New Year's time, so there was sort of a perfect storm of factors going on there that really majorly increased demand of the quitline. So there are a number of factors that do influence calls to the quitline in addition to funding, and I just wanted to touch on those, and I've already mentioned some of them. But so paid TV media, for example, the CDC's Tips from Former Smokers campaign, the national TV campaign. This has run maybe 4 or 5 years now, and the most recent one ran January through July of 2017. And when TV is on the air, it is the #1 driver of calls. In the absence of TV, the #1 driver of calls to the quitline is healthcare provider referral, either directly to the quitline via a fax or an electronic health record, or a verbal referral where the healthcare provider encourages the patient to call the quitline when they're ready to quit. And they often provide the quitline promotional materials like the business card or brochure at that point. After healthcare provider referral, the next driver of calls is word of mouth. Someone who called the quitline based on a recommendation, so a family member or friend who had a good experience with the quitline and encourages somebody else to call as well. I think that speaks well of the quitline. And the other two big drivers are, which I actually mentioned on the previous slide, are policy changes like an increase in the cigarette excise tax or smoke-free air laws, and also seasonal variations. So the quitline gets more calls in January, for example, because of the New Year's resolution time, than in the middle of the summer. So back to this healthcare provider referral, we rely on the work of our regional outreach specialists, Chris Hayden, Roger Dyer, Allie Gorilla, Amy Scora, to do the important work of integrating the Wisconsin Tobacco Quitline into smoking cessation treatment being provided by healthcare providers. So one easy way they they help link the provider and the patient directly to the quit line is through a paper fax referral or an electronic referral in the electronic health record. And once the quit line receives that referral, they proactively reach out to the patient to enroll them in services. And the healthcare provider stays in the loop because the quit line sends them information back about the outcome of the referral. So not only does this referral increase and improve access to evidence-based services, it also potentially improves quit rates, as we discovered in an evaluation that we did in 2010. So here we really were studying sort of the effectiveness of fax to quit, and what the evaluation showed is that it did document a high level of satisfaction among really all participants to the quit line, but also a statistically higher quit rate among the fax to quit group at a 30-day follow-up call. And this is probably due to a combination of healthcare providers' advice to quit, which holds a lot of weight, the healthcare provider developing a treatment plan with medication, prescription, and then the referral to the quit line as a treatment extender to help continue the counseling piece of that treatment plan. And just as an aside, we are currently conducting a research study comparing fax referral and this electronic referral called e-referral, which will examine the rates of referral between those two methods and quit rates. So here's just a quick snapshot of some demographic information of registered tobacco users in 2016. Much of this information is typical year to year. We have more females than males calling. It's about a 60-40 split. Most of the people calling the quit line are cigarette users, but we're seeing an increase in dual users, so they use cigarettes plus smokeless tobacco, cigar, pipe, or e-cigarettes even, which we started measuring a couple years ago. And so middle age 41 to 60, just over half in 2016. You can see also in the reported insurance, 51% report self-report being a Medicaid member or not having insurance, which is a priority of the quit line to serve people with the fewest resources. Half of people calling report one or more chronic condition that's exacerbated by tobacco use, like asthma, COPD, heart disease, and I have seen that increase a little bit over the years as well. So now I'm going to move on and provide some detail about what services are available, and these four here on this slide are really the primary services, starting with the Quit Coach Call, which is available to anyone 13 years of age or older. No parental permission is required. It's a one-call program with a Quit Coach, but a tobacco user really has unlimited access to that one-call program. They can re-enroll in it as many times as they need for help over the course of their quit attempt. Generally, this first call could take 30 minutes on average. It includes first talking to a registration agent at intake, where they collect some demographic information and some baseline tobacco use information, and then transfer them to a quit coach where they do a pretty thorough quit history. They assess level of dependence. For example, how soon in the morning does someone need that first cigarette? They talk about motivation and confidence in quitting, and then they help them develop an individualized quit plan. And then they discuss the FDA-approved medications, there's 7 of them, and then provide decision support if the patient is interested in the over-the-counter nicotine replacement therapy that's available through the quit line. And so that is a 2-week starter kit of NRT. The patch, gum, or lozenge is available only to people 18 years of age or older. The Quit Coach does a screening to determine if a patient has any use exclusions, like having a heart attack or stroke in the last 60 days or currently being pregnant. One thing about that, though, I'll mention is if a patient does have a use exclusion but is still really interested in the medications, they can request that the Quitline fax a healthcare provider override to that caller's provider. The provider just signs the form and faxes it back to the Quitline, and the patient can then get the medications through the Quitline. The starter kit is available once per 12 months per caller, and it is directly mailed to the caller's home, usually within 10 days, and that's kind of timed around when they typically might set a quit date out in advance. So the third service from that introductory slide was the web coach, and this is one of the more popular features. It's an interactive website, and it's meant to be provided in conjunction with the phone coaching, so the content very much aligns. The participants can go to this website to build their quit plan, to track their progress, so having things like money savings calculators. There are discussion forums where they can talk to other tobacco users. There's a huge variety of topics in the discussion forums. If they wish to, they can receive tailored coaching emails. There is a Spanish web coach available, and both have unlimited access available 24/7. The username and password never expire, so long after a person talks to the Quitline, they can still access web coach. And right now, actually, the platform is going through an upgrade, and with just sort of making the functionality and the look and feel and content all updated, and that should be completed by the end of 2017. But if you want to look at a video demonstration of the current functionality of web coach, I list here a website, or the web page on our site, that has a short sort of tutorial on web coach. And the final core service of the Quitline that I want to mention is the Quit Kit Quit Guide. This is a set of mailed self-help materials. It's very tailored to the individual, and the centerpiece is the 60-plus page quit guide, which walks through dealing with urges, using the medicines, getting social support, how to prevent relapse, and the content aligns with the coaching and the web coach as well. Other materials in the Quit Kit include these support materials on a variety of topics, again, sort of tailored to either the demographics or the type of tobacco of the caller, including smokeless tobacco materials, youth, for pregnant women, for Spanish speakers. It's a brochure really for Native American callers, and then some individual fact sheets on some of the chronic conditions that are exacerbated by tobacco use. And the final piece in the Quit Kit is the Ally Guide, which it's provided to every tobacco user, as well as if somebody identifies themselves as a proxy caller. And this is something that a tobacco user can give to a family member or friend to help guide them on how to be supportive while the tobacco user quits. One resource I want to mention that it's free to anyone, and it's available sort of a standalone apart from the Quitline, but it was developed by Optum, is their Quit Now mobile app. It's not meant to be used in conjunction with the phone coaching. This really is a standalone tool. It's just another tool in the toolbox, so to speak. And again, it's a free download, and I list the links here where you can get it for free. And importantly, it has not been evaluated for its effectiveness. So up to this point, I reviewed the standard set of services available to any Wisconsin tobacco user, but I do want you to be aware that some callers, based on their insurance or their employer, are eligible for a different set of services. For example, Aurora Healthcare provides a a 5-call program and 8 weeks of a nicotine replacement therapy to their caregivers and spouses of their caregivers. Physicians Health Plan offers to all their members an unlimited enrollment in the 5-call program and 8 weeks of NRT. And the eligibility for these different set of services is determined at registration intake. It's what the Quitline calls their coordination of benefits. CTRI also periodically has secured federal funding to run Quitline-based research studies in which, callers, again, across the state might be eligible for an enhanced Quitline experience. We recently worked with Wisconsin Medicaid and the Tobacco Prevention and Control Program to conduct the Striving to Quit study for Wisconsin Medicaid members. And they received a 5-call program and monetary incentives for engaging in Quitline services and also for abstinence. So some information about the Quitline materials, the promotional materials. At this time, these materials are still available through our Madison office and our outreach specialists. We don't currently have funds to ship the materials, so if you go to our webpage here, you can see, I guess, a few methods to get the materials, including picking them up here at our office if you happen to be in Madison, and or providing a FedEx account number so that we can bill the shipping charges to that FedEx account. Some health systems are able to take on the cost of printing their own materials using our electronic print files, either with their print shop or a local vendor. But there are also lots of fact sheets that are available on our website that would function just as well. And again, you can kind of find all that information on this webpage that I mentioned here. And I want to remind people of the Quitline website, which has a lot of resources, videos about things like web coach, what someone would experience calling the Quitline, actual testimonials of people who have worked with the Quitline, and lots of other resources. And here's my contact information. So I encourage you to use that anytime you're looking for information on the Quitline. And finally, I just want to leave you with a small sampling of comments we've received from Wisconsin callers who have used the Quitline. These comments help illustrate how important the services of the Quitline have been in helping tobacco users across the state on their journey to becoming smoke-free. So thank you to the Wisconsin Tobacco Prevention and Control Program for providing the leadership and funding to make these services possible. And that concludes the Wisconsin Tobacco Quitline webinar. Again, if you have any questions or want to follow up, you can certainly call me. My contact information was available on the prior slide, and I believe these slides will be available for download and or one of our regional outreach specialists. So thank you very much. Have a good day.